So let's start with the lenses and talking about cataracts because I feel like that's something pretty much everybody has a sense of cataracts are bad and dogs get them. So can we talk a
I
little bit
do.
about that and how we'll know if this is a problem or what we should be looking for?
Sure. So, unfortunately, there are some dogs that have cataracts. Most frequently, if we see the cataract coming on quickly, it's due to diabetes.
Mm,
So, these diabetic dogs, in particular, cats tend to be a little bit more resistant to developing cataracts associated with their diabetes. But
mm,
if dogs have diabetes frequently, almost all of them will develop cataracts, no matter how carefully you try to monitor them and manage their diabetes with insulin. And we only have insulin as a treatment for dogs with diabetes. There is no other treatment. Basically, all diabetic dogs have what's equivalent to human type 1 diabetes, which is the juvenile diabetes.
mm.
We don't have any other treatment for that. Cats, on the other hand, they do have now two drugs on the market from different companies that are oral hypoglycemic. Well, they actually don't make the glucose go down, they just make the body respond better to insulin. So we do have drugs that you can give a cat, and I've got one on the Bexacat product that's a tablet you give once a
Mm,
day, and it's actually not that hard to give, remarkably, considering it's a cat. And
mm.
this is not an easy cat to manage. He doesn't really like it very much when we look at him, much less touch him to draw a blood sample. So there are oral drugs that do treat diabetes for some cats, but they have to be under 13. They have to be recently diagnosed. They can't have already been on insulin. There's a whole bunch of rules about treating
Mm.
these diabetic cats. So they can be on insulin, they can be on these two oral drugs. But cats usually don't get cataracts. Dogs, on the other hand, the first symptom that you might notice associated with their diabetes could potentially be cataracts. I've had a couple of dogs come in that went from a clear eye to this opalescent, beautifully opalescent, unfortunately non visual
Mm,
eye
mm.
because the cataract becomes dense really quickly. So we can see lenses that have cataracts due to nutrition. We can see cataracts associated with diabetes, and we can see cataracts that are genetic.
Mhm.
So obviously, people that are breeding dogs want to avoid breeding dogs that have genetic cataracts.
Right.
So that's why many of us go to the CAER exams, it used to be called SURF,
Mhm.
and have our dogs tested so that we're not intentionally or unintentionally developing a line of dogs that has cataracts. So very important that people know that. Now, the other thing that's important to know is a lot of older dogs, almost all older dogs, end up with a cloudy looking cornea.
Mhm.
I'm sorry, not cornea, lens. So a
Lens, right.
cloudy lens. And that's nuclear sclerosis. That is not a cataract. It's not going to progress to a cataract. It's not serious. It's just one of those weird things that
That like
sometimes
old
dogs.
dog eyeball that we
Yeah,
see
yeah.
sometimes.
Yeah,
Uh,
when you look at a dog, when they
mm,
walk into my exam
mm,
room or you see them at the park or on the
mm,
street or at your friend's house, you may notice a little white on their muzzle, a little
mhm.
snow on the muzzle, and you may notice that their eyes look a little cloudy, and that's nuclear sclerosis. It doesn't progress to cataracts, it doesn't interfere with their vision.